Hi, I'm Dr. Cogan. Thank you for joining us on this webinar. I recognize this is a little bit different for a doctor to do. Most of you have never had a doctor take the time to give you this information. However, I believe everything happens for a reason, and I'm here with you today as a result of something that happened to me a little over 35 years ago. 35 years ago, I was a high school wrestler. I was thrown in my back and I felt lightning bolts go down both legs. I was literally paralyzed for about 5 minutes. When I was able to move, the pain was so excruciating that when I tried to stand up, I collapsed down on the mat. After that, I couldn't continue. I went to 11 different doctors over the next several days trying to find some answers. So if you're wondering, why did I go to 11? If you think of the answer, I bet you can guess. I wanted someone to tell me what I wanted to hear. See, all the doctors agreed on one thing. I would not be able to wrestle in the freestyle state championships that were coming up in 2 weeks. And most of them agreed that I'd never play another sport ever again for the rest of my life. So I was on a quest to find somebody to tell me what I wanted to hear. So I went to a 12th doctor. And after he examined me and reviewed all my scans, he sat with me knee to knee and looked me straight in the eye and said, "I'll have you ready in 2 weeks." 2 weeks later, I was a 112-pound freestyle state champion. I don't tell you that to impress you. I tell you that to impress upon you that just because somebody says you have to live with an ache or a pain or a condition or a problem, even if it was a doctor, they may not be right. And even if they were right 10 years ago or 5 years ago or even 6 months ago, because of how fast technology changes, they may not be right today. Well, I decided that day as a sophomore, and I'd always wanted to be a doctor. I wanted to be like that guy. Not in the type of practice that he had, but the way he thought outside of the box, looked for things that were newer and different, and used technology in a unique way to help people when everything else failed. So when I graduated many years later and became a doctor, I was more than motivated. I was inspired. And as a result of that inspiration, I built one of the largest single doctor non-surgical practices in the country, seeing over 650 people a week. Do the math on that one. That's a lot of people. And it was a little bit crazy. As a result of seeing so many people, I happened to see a professional athlete as a patient and an Olympic gold medalist as a patient. And what I learned was athletes are friends with other athletes. So within about a 6-month period of time, I was seeing some of the players on every single Detroit team. As a result of that, almost 18 years ago, the Detroit Lions asked me to be one of their team doctors, where I covered 256 out of 260 games in 13 seasons. Now that's a little crazy too. And that was both home and away. As a result of that, I got to meet the governor, who had appointed me to the state board, and where I served for 8 years. And I was elected as chair, and I served as chair of that board for 6.5 years. And any chairperson of any board in the state of Michigan, their job, besides being part of the board, is to look at any complaint that's made by a public person. So if someone made a complaint against one of my colleagues while I was the chair, it would come across my desk, and my job was to look at it and determine if it looked like there may have been a violation of the Michigan Public Health Code. And if there was, I'd authorize an investigation. If there wasn't, I wouldn't. Well, one day I was sitting at my desk, and a complaint came across my desk about 2 doctors that were doing something called non-surgical spinal decompression therapy using a device called the DRX 9000. Now, what was interesting about this complaint is the complaint was not about the device or the treatment. It was about their advertising. They were advertising full-page ads, and they were advertising that this machine had something to do with NASA and an accidental space finding. Now, I knew what it was because I've been in healthcare for many years, but I wasn't really familiar with the great details on this equipment. So I decided to get on a plane and fly to my friend's office in Chicago, where he had 5 of these machines, and they had a very unique practice. His practice had 2 criteria to be a patient. 1, you had to be diagnosed with a herniated, bulging, or degenerative disc or spinal stenosis, and that had to be demonstrated on MRI, and you had to be told that you needed surgery. So I flew out there and I spent the morning with him, a couple hours, and I went through a couple hundred files, where he showed me that over 85% of the patients that had these severe back conditions, over 85%, had terrific results, many of them pain-free, and none of that 85% having surgery at all. It was kind of hard to believe. So I asked him if he'd mind if I spent the afternoon with him seeing patients. So I changed my flight, and I spent the next several hours seeing patients with him, hearing the same story time and time again, that they didn't want surgery, they saw surgeons, and they decided to try this method as opposed to surgery as an alternative. And probably almost 85 or 90% had nothing but terrific things to say. So what I learned was this was a very high-tech, useful piece of equipment. I also learned that it had nothing to do with NASA or any accidental space finding. So as I was packing up to leave, my friend looked at me and said, "Now it's your turn." So here's what I didn't tell you. What I didn't tell you is, although I was able to wrestle and win that freestyle state championship, I had a chronic back pain. Not a severe back pain, but a chronic back pain. I had a dull ache in my low back and a little numbness in my leg. Didn't keep me from doing anything. I did everything I wanted to do. I wrestled and did judo nationally and internationally. I ran 6 marathons, including Boston, but I just had this annoyance, and my friend knew about that. And I looked at the machine, and it looked like an MRI. There were bells and whistles and lights, and I thought to myself, there's no way you're getting on that. So I looked at my friend, and I said, looked at my watch, and I said, I'd love to, but I really need to go. I got to catch the flight. He looked at his watch and said, your flight is not for 3 hours, and I'm literally 20 minutes from the airport in traffic. Lay down. So reluctantly, I did. I laid down on this machine, and within 10 minutes, it was the best I felt in 10 years. Next day, I bought a machine. So what started off as an investigation brought me full circle back to where I started looking for things that were newer and different to help people, and everything else failed. So when I got on the flight that evening, I started thinking about the type of treatment we were providing professional athletes. And if you don't think they get better health care than you, then you're deluding yourself. Healthcare, professional athletes get way better health care than we do. And there's really multiple reasons for that. One is absolutely they have newer technology and better technology and newer equipment. And they also have a group approach where colleagues work together from different disciplines to make sure that the patient gets the best care ever. See, when you get sick, you call the doctor and you make an appointment, and you do what? You wait. And then when you go to see the doctor, you fill out all the paperwork and you wait. And then you go into the room and you wait. And then the doctor comes in, he talks to you real fast, you forget what you're going to ask, and he leaves. Well, when a professional athlete gets injured, they don't go to the doctor goes to them. And it's not one doctor, it's multiple doctors. They typically, when they have an injury, they'll see an internal medicine doctor, a physical therapist, a chiropractor, a sports medicine doctor, an orthopedic surgeon, all working together to help the patient get better using the best and newest technology. It was that moment that I decided I wanted to bring the same type of technology that we use for professional athletes to use on regular people, because it's simply the right thing to do. So I'm glad that you're here. And I really incorporate, if you incorporate into your lives the things we're going to talk about today, you'll reap the benefits. Earlier, we talked about professional athletes and how they get better health care. So if I were to ask you if you think that's fair, I'd get a resounding no, but it's a fact. Why is that? The fact is that professional athletes are a commodity to the team. The team needs them to play in order to create revenues. And the fact is that professional athletes are owned by rich people that also have very smart advisors. And those people know they have to keep the players playing in order for the team to make money, especially their star players. Now, players are also represented by smart people, which are their agents. And the agent's job is to protect the athlete. In the old days, if a professional athlete was injured, let's say they had a shoulder injury, they would inject them into the shoulder with a numbing agent and allow them to go back in the game. Or when they had a concussion, when they were feeling a little bit better, they'd get them back into the game. The Players Association and agents won't allow that anymore because it's just not in the player's best interest. Because if the player can't continue to play and be safe and healthy, then the agent doesn't continue to make money. So now it's become imperative that the healthcare is so good for professional athletes that they don't just feel better, but they're healed faster in order to get to the game. And we talked about how technology is a part of that and a group approach is part of that. I'm gonna give you one more example. Most of you here on this webinar today have had physical therapy. You may have tried physical therapy or chiropractic or massage or acupuncture or pain lasers, and you've had some sorts of treatment. If I were to say to you how many times a week, if you were unmuted right now, and I was to ask the group, how many times a week did you have physical therapy? I guarantee you the rousing majority, the vast majority would say 3 times. Did you all have the same condition? Did you have the same injury? Did you have the same problem? Why is it that if I were to ask 100 people, probably 90+% of them would say 3 times a week? It's because that's what someone at some insurance company would pre-authorize or allow. If one of the Detroit Lions, Red Wings, Pistons, or Tigers had the exact same problem as you, how many times a week do you think they'd have therapy? The most common answer I get is every day, but the truth is 2 or 3 times a day. So while you're suffering with your problem for months or years or what could become a lifetime, we'll have those players playing in a matter of weeks, and I don't think that's fair. I also didn't tell you that I take care of the Detroit Lions, which I've done, or the Detroit Tigers. I used to take care of the Lions, and now I take care of the Tigers, and have done that for several years. And I will tell you, it's across the board. They get therapy delivered in a much better way than we do. And that's why it's so important to me to provide the same type of therapy to regular people that we do professional athletes, because it's just the right thing to do. Now, there are 6 facets of health. I like to think of them as links on a chain. Always trying to remember a chain's only as strong as its weakest link. I'm not going to go over all of them today, but we'll be having more that are specifically on facets of health and nutrition and things like that. But I want to talk about a couple of them that you can walk away after this webinar to use to feel better. The first one is exercise. Everybody needs to exercise. Now, quite often when I do this live, I see people that walk in wheelchairs, or they come in wheelchairs, walkers, or canes. And when I talk about exercise, those are the people that usually tune out and start checking their text messages. The reality is everybody, including them, needs to exercise. Now, I'm not saying that you need to have 20 minutes of cardiovascular exercise 3 times a week, or to buy tennis shoes, or join a gym. But what I'm saying is you've got to move. Everybody's got to move. If you've ever injured your shoulder, you know the first thing you do is protect it. And when you protect it like that, what happens? It gets stiff. And when you try and move that stiff shoulder, it hurts more, and it's a downward spiral. So contrary to popular belief, what you've got to do in most cases is start to move. And you move it within the confines of pain. As you move it, it gets looser. As it gets looser, it hurts less. And instead of spiraling down, we've got to start spiraling up. The second thing I want to talk about is nutrition. And time is a factor, so I'm not going to give you a whole course on nutrition today. We'll do that another day. But I want to tell you 1 thing to do and 3 things not to do. First, your body's made out of mostly water. Your body's made out of mostly water. Water does 2 things. Water hydrates you and flushes your system. Hydrates you and flushes your system. What are you supposed to do when you're sick? Drink a lot of water, right? What else are you supposed to do when you're sick? You're supposed to get rest, take vitamin C, and depending on who your mother is, maybe chicken soup. So I've got a question for you, because I said to you early on, I want you to use common sense instead of your first reaction. If you did the things you're supposed to do when you're sick, if you did them when you're well, do you think just maybe you'd get sick less often? Absolutely. Start doing those things. Drink more water, get more rest, take your vitamins, have some chicken soup. And by the way, I'm talking real chicken soup, not what you buy in the can, because in chicken soup, if you've ever made it, you put a whole chicken, bones and all, and what leaks out of the bones, there's bone marrow, and that's where stem cells come from, and it's anti-inflammatory, and all that stuff is good for you. So back to water. Water hydrates you and flushes your system. In our clinic, we specialize in seeing patients with bulging herniated degenerative disc, spinal stenosis, sciatica problems, and we also see people with nerve problems, peripheral neuropathy. And if you don't know what peripheral neuropathy is, it is defined as disease or dysfunction of 1 or more nerves, often causing pain or burning or tingling, numbness in their arms, legs, hands, or feet are really the most common areas. People get peripheral neuropathy for a lot of reasons, but diabetics especially. 70%, a research shows 70% of diabetics will develop peripheral neuropathy at some point in their life. Other people get it too, but it's a big problem for diabetics, and we know exactly why they get it. See, they get peripheral neuropathy because by definition, they don't have the ability to take their blood, the sugar out of their blood, and their A1C or blood sugar rises, and that high level of sugar in their blood damages nerves, usually the small nerves in their arms, legs, hands, or feet. So I'm going to ask you a crazy question. If you were a diabetic, do you think it would help to drink more water and flush your system? Absolutely. It's not the end all be all. It's not the cure, but it certainly will help. Anyone with any neuromusculoskeletal problem, drink more water. It's the simplest thing you can do to help. Now, is Detroit water good? It's not bad. Bottled water, better, sure. The best thing is distilled water. Patients with disc problems or spine problems traditionally had three options. One is to live with it. Unfortunately, for many people, their pain is affecting their life in such a way it's really not bearable. For all patients with disc problems, it's a degenerative condition, meaning it gets worse with time. Second option is to manage it. A lot of ways to do it. You can take anti-inflammatories, painkillers, physical therapy, chiropractic, acupuncture, massage, epidurals, pain lasers. Any and all these things can help you feel better either for a short period of time or an extended amount of time. None of them are going to actually repair a bulging disc. The only corrective option that was widely used up until about a decade ago or so is surgery, where basically you'd remove part of the disc or part of the bone or both to free up the nerve or do that and fuse it. Here's the problem with spine surgery. It's got about a 40% success rate and always leaves the spine less stable than it was before. Even if you fuse it, above and below the fusion can get weaker with time. Now there are newer and better therapies that address the actual cause instead of just the symptoms. But before we talk about that, I need to spend a few minutes talking about technology. And in order to talk about technology, I want to take you back 45 years ago. And I was 7 years old then. I was a second grader. And I remember back in those days, 45 years ago, walking home from school on a nice spring day. I would drop off my bags at my house and go play in the neighborhood with all the other kids. I grew up in a really special neighborhood called Beacon Square in Southfield, Michigan, and every house had a kid. I actually believed that if you didn't have a child, you couldn't live in the neighborhood. Well, so I'd come home from school, I'd play in the neighborhood, and all the kids would play together throughout the neighborhood until dusk, when one of the moms would yell out through the door, "It's time to go home." The message would get passed through the neighborhood and all the kids would come home. Those were the days where we all had one phone in our house. The phone was on the wall in the kitchen with a cord. It was a disgusting color of green or yellow. If we went back to those days, and oh, and by the way, there were no computers. There wasn't even AOL then. There was no real internet that people had access to. If I went back to those days, and I was to tell you back then that in the not so far future, everyone over the age of 12 is going to have a cell phone that doesn't need a cord, and you can take it anywhere and call anywhere across the world, and long distance and local is the same price, you would have said, that's crazy. And if I went on to talk about that on that device, there would be a computer that probably has more processing capability than your bank computer, you would have said, no way. And then if I was to go one step further and tell you that on a phone or a computer or any device, you could have a FaceTime conversation with a friend or a relative while they're on another continent, real time for free, the resounding answer would be, you've watched way too much Jetsons. Well, technology and healthcare has changed every bit as much as the technology and telecommunications, just nobody's telling you about it. Now there are newer and better therapies. One example of technology is laser. Laser's been around for over 55 years. It's been used in healthcare for over 50 years. And I can attest to the fact that it's been used for over 20 years in professional athlete training facilities. And you're just starting to hear about it now because some different companies are advertising it. Laser really does three things. It increases blood flow, it decreases inflammation, and it stimulates the part of the cell that's responsible for healing. Now, There are a lot of therapies that can increase blood flow, as simple as a hot pack. There are other therapies that can reduce inflammation, as simple as an ice pack. There's very few therapies that do those two things at the same time. But laser is one of the only therapies that can stimulate healing via the mitochondria by using light and laser. So it's a very interesting and effective technology. Now, there are 4 classes of laser. They're class 1 through 4. The classification has nothing to do with the effectiveness of the laser. It is a safety rating mandated by the FDA. A class 4 laser can cut you or burn you. A class 1 can't. I use class 1 superpulse lasers on our patients really for 2 reasons. 1, they're safer, and 2, I find them to be more effective for most of the conditions that we need. And I've got access to every type of laser, but it's the one that I choose to use. By the way, there are some people that will tell you lasers cure everything. That's simply not true. Laser is a very good therapy. It is an adjunctive therapy. What that means is we typically use it in a protocol with other therapies, but not the only therapy. See, there's an old saying that if all you have is a hammer, everything looks like a nail. So although therapy is using a laser can be very good, it is not the end-all be-all. It will not cure all conditions, but it can be an important part of a program that is designed by a licensed professional that's educated in these advanced technologies and can help put them together for your best interest. Traditionally, if we were in a group setting, I would bring someone from the audience out and I would have them take a seat, and I would talk to them for a few minutes about their condition and then use the laser on them. And the great majority of the time, after I treated them, they felt better and noticed a difference. And I would say it has almost never failed. See, the interesting thing with laser is this. If you do not notice if we don't see a clinical change, or you notice a change in the way you feel, your body may not respond to it. So don't let someone tell you that it's going to take 1 million visits. We want to know and have a feedback mechanism to know how well it could possibly work for you. Let me be very clear. Although lasers are helpful in treating pain in certain conditions that are inflammatory, it will not repair a bulging, degenerative, or herniated disc. A laser cannot push disc material back into the spine. It just can't do it. You can't do it with physical therapy. You can't do it with chiropractic. You can't do it with an injection. We have come up with a patented proprietary method that is an alternative to surgery to repair bulging, herniated, and degenerative discs. We've proved it by having an independent researcher come out, do a study on our patients that was published in a peer-reviewed journal showing better than a 90% success rate. I'd like to show you what intradisc neutrosis can do for you as it had done for me.
Intradisc neutrosis represents the latest technology in spinal disc treatment, allowing the body to heal itself naturally, without surgery. With intradisc neutrosis, treatment is isolated on the vertebrae surrounding an injured disc, which is often the source of back or neck pain. During treatment, intradiscal pressure is dropped, allowing water, oxygen, and nutrients to enter the vertebral disc area. As the pressure in the disc is decreased, bulging disc material retracts, and damaged structures in the spine are healed and rehabilitated.
Basically, that's it in a nutshell. What we do is we take the information from your MRI or our findings, we put it in one of the computers in the machine, we change the angle so the computer helps us isolate that disc level. 80% of the force is focused there, and as we gently separate it, we're creating a vacuum inside of the disc, bringing back in disc material, water, oxygen, and nutrients, and repairing a disc as much as it can be repaired. We know it works because besides people telling us they feel better, we've done pre and post MRI. So this is an MRI of a patient that has a pretty severe herniated disc. This is the exact same patient about halfway through their treatment. So if you look at this picture, you'll see it is no longer bulging at all and actually becoming hydrated. We do select candidates very carefully. Not everybody is a candidate. I would love to be able to tell everyone on this webinar that we can help you. That wouldn't be true. We do select candidates very carefully. First, we rule out any contraindications. We want to make sure that it's safe to treat you. We will not take you unless we're convinced that you're a good candidate for treatment. We always want to determine the most cost-effective way to treat you. It doesn't mean that it's covered 100% or that there's no out-of-pocket expense, but we always want to come up with some payment options, if necessary, to help you get the care you need. And we've never had a patient that really wanted the care that we didn't find some way to help assist in that. Our patients need to be willing to make some lifestyle changes. And then ultimately, I really always look at what my real odds of success are. Out of every 10 people that we see in the office, we may accept 3 or 4. 1 or 2 out of 10 just plain out candidates. 4 or 5 out of 10 that I don't find to be good enough to get the results I or they want to get, so we don't take them. So basically, I stack the deck and I only take people that I really believe that we can help. The treatment is always designed specifically for you. It is not a one-size-fits-all treatment. It can include any of the things we've talked about today. It can include laser, intradisc neutrosis, pulsed electromagnetic therapy, nutritional therapy, vibration, core stabilization. It's always designed specifically for you. Like I said earlier, I wish I could sit here and tell you I can help you, and that just wouldn't be true. I can't tell you without knowing. Here's what I can promise you is if we can help you, I will tell you that. If I really believe we can help you, I'll tell you that. If not, I'll tell you that too and point you in the direction of someone who can. If you're sick of living in pain and want your life back, I want you to click below and request a visit or a free telephone consultation where we will pre-screen you to see if you may be a candidate. Normally, a consultation and examination in the office is a 2-day procedure where day 1, you will not see me, you'll see one of my assistants. They will gather all the information, they'll get all of your testing that you've had, they'll gather your information, we'll review it, set you up for a time to see me. If we feel we may be able to help you, then set you up for a time with me for an additional consultation and examination. Normally that 2-day process is $385. As a result of you following through on this webinar in its entirety, we're offering it for no charge, but there's one catch. And the catch is you need to click below and request a phone consultation or appointment today. You have been great. Thank you very much, and God bless.